The key priorities for public health are to ensure really that all our residents enjoy a good quality of life as well as length of life. And what we want to do is ensure that our programmes in terms of addressing fuel poverty and excess winter deaths are reaching those residents in terms of our Warm Homes Healthy People programme. In 2014, the Health and Wellbeing Board in Suffolk adopted the Housing Charter as a result of key principles to work with housing providers and system partners to ensure that housing was identified as a key determinant of health.
My name is Gary. I'm the Health Liaison Manager at Suffolk Coastal District Council for the Warm Homes Healthy People project. The aims are actually very simple: to keep patients warmer and healthier at home, and hopefully reduce hospital admissions, readmissions and delayed discharge. In Suffolk we have over 43,000 homes living in fuel poverty, and in the winter of 2014-15 we had 753 excess winter deaths. And the issue for the hospitals is, for every excess winter death we have an average of 8 hospital admissions. I've been given an honorary contract to work with Ipswich Hospital, and that's enabled me to attend stranded patient meetings and red to green meetings. And the purpose of those meetings is to identify patients whose discharge may be delayed, and where I come in is I try and help those who may be delayed due to heating, and we provide an intervention and I make a referral into our project.
So one of the biggest challenges that we face in meeting our ambitions for hospital services is trying to ensure that we're able to provide that inpatient care for our patients, for those that need it. And one of the things that prevents us from doing that are those patients that are stuck in hospital waiting for those services out in the community. And in this case, some patients are waiting for some renovations to happen at home, or they don't have any heating at home that would enable us to discharge those patients back to where they would prefer to be. So partnership working is one of the most important things that the organisation needs to focus on now, and that is working with a range of different providers, voluntary sector, and also those statutory organisations like the local authority, GPs, mental health organisations, etc., to enable us to ensure that when we are trying to discharge patients back to their own homes, that we're able to do that most effectively through the interaction of each of our services. So the Warm Homes scheme helps us to facilitate an early discharge for patients. We have some heaters that are on loan for patients, so we can give out those heaters almost as soon as they're requested, so patients can go home on the day that they are due for discharge.
So Warm Homes Healthy People has been a fantastic initiative that has really helped us through quite challenging winter months. Gary has been an integral part of the team. He's attended board rounds, he's spoken to the chief nurse, senior leaders in the hospital, and really helped us understand what is available, what help and support is available in our community for people who are going home to cold homes or have got issues with heating. It's really, really important that they are looked after, and Gary and the team have really made a massive difference in how they've worked with our team and with our staff.
We can't do it on our own. Partnership working is absolutely crucial. I think a couple of years ago it was all about blame. We'd blame local authorities, for example, for delayed discharges. We'd blame primary care and community care because they weren't providing the right care at home. They would blame us for discharging patients too early, and therefore they were coming straight back in because they were too sick to be cared for in their own environment. That doesn't happen anymore. The work that we've done locally in both Suffolk and North East Essex has transformed the way that we deliver care through the winter, working closely with our neighbours, working closely with other agencies, professionals working together to maintain people in their own homes is the only way we've been able to manage the winter, and we need to do more of that involving the third sector, making sure that we provide the best possible care to people in their own homes and they only come into hospital when it's absolutely essential. Cold weather has a really, really serious impact on the hospital. We know, for example, if the temperature drops below 2 degrees against average for anything more than 2 or 3 days, we see a 10% increase in respiratory disease and cardiac disease coming into the hospital. That's a direct result of the cold snap.
So Gary's come to spoke to us in some of our occupational therapy team meetings, just made us aware of how the services can help OTs assist a safe discharge. So for example, there's things like loan heaters available, can supply oil, look at doing referrals to getting new boilers or boilers fixed. So just working together with Warm Homes Healthy People means that us as OTs can really help to have a safe discharge for the patients.
Even you go out there, you could set a jelly and they can serve it in 10 minutes. It was a misery. Last winter, I was miserable. I was cold and miserable. Oh, I don't know. It wasn't a happy house. It wasn't a happy house. I wouldn't have known what I would have done without you. I'm so grateful. Now, I'm going to cry now. It's changed my life. I'm happier. I'm not down in the dumps no more. I'm not cold. Happy, content. So is my cat.